Naproxen, also known as Ec-Naprosyn, is a medication used to relieve mild to moderate pain from various conditions and to reduce pain, swelling, and joint stiffness from arthritis. It is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, it's important to talk to your doctor about non-drug treatments or other medications that may help manage your pain. It's worth noting that this form of naproxen is absorbed slowly and should not be used for pain that requires quick relief, such as during a gout attack. If you have questions about using a different form of this drug or other medications for quick relief of pain, be sure to consult your doctor or pharmacist for guidance on the best course of action. Before you start using Ec-Naprosyn, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily with or without food. Swallow the whole tablet with a full glass of water, unless directed otherwise by your doctor. Do not break, crush, or chew the tablets, as this can increase the risk of side effects. After taking the medication, do not lie down for at least 10 minutes. The dosage of Ec-Naprosyn is based on your medical condition and response to treatment. To reduce the risk of side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed. For certain conditions, such as arthritis, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Ec-Naprosyn may include upset stomach, nausea, heartburn, headache, drowsiness, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Ec-Naprosyn may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Serious side effects may include easy bruising/bleeding, difficulty swallowing, changes in hearing, mental/mood changes, signs of kidney problems, unexplained stiff neck, vision changes, and symptoms of heart failure. It may also rarely cause serious liver disease, so seek medical help immediately if you experience symptoms of liver damage such as nausea/vomiting, loss of appetite, dark urine, or abdominal pain. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as fever, swollen lymph nodes, rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Taking Ec-Naprosyn, a nonsteroidal anti-inflammatory drug, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be higher in older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important to avoid taking this drug right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, which can occur without warning. Older adults may be at a higher risk for this effect. If you experience stomach pain that doesn't go away, black or tarry stools, vomit that looks like coffee grounds, chest or jaw pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, it's important to stop taking naproxen and seek medical help immediately. Before taking this medication, it's important to talk to your doctor or pharmacist about the benefits and risks. They can provide guidance on the daily dosage and the best timing for taking Ec-Naprosyn. Before taking Ec-Naprosyn, it's important to talk to your doctor or pharmacist if you have any allergies to naproxen, aspirin, or other NSAIDs, or if you have any other allergies. Be sure to also discuss your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or other health conditions. It's important to stay hydrated while taking this medication, especially if you are older, have heart failure or kidney disease, or are taking certain medications. Dehydration can lead to kidney problems, so be sure to drink plenty of fluids as directed by your doctor. This medication may cause dizziness or drowsiness, and alcohol or marijuana can make these effects worse. It's important to avoid driving or using machinery until you know how this medication affects you. Additionally, daily use of alcohol and tobacco can increase the risk of stomach bleeding, so it's important to limit alcohol and stop smoking while taking this medication. It's also important to limit your time in the sun and use sunscreen, as this medication can make you more sensitive to sunlight. If you are pregnant or plan to become pregnant, be sure to talk to your doctor about the potential risks and benefits of using this medication. This drug can also pass into breast milk, so be sure to consult your doctor before breastfeeding while taking Ec-Naprosyn. It's important to be aware of potential drug interactions when taking Ec-Naprosyn. Some medications may change how Ec-Naprosyn works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ec-Naprosyn include aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, and water pills, diuretics. It's also important not to take this medication with antacids or other drugs that decrease stomach acid, as they may affect the enteric coating of the drug, causing it to be released too quickly and increasing the risk of side effects. Ec-Naprosyn may also increase the risk of bleeding when taken with other drugs that may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that are similar to naproxen and may increase the risk of side effects if taken together. It's also important to be aware that Ec-Naprosyn may interfere with certain lab tests, possibly causing false results. Make sure lab personnel and all your doctors know that you use this drug. If you have any concerns about potential drug interactions, be sure to discuss them with your doctor. If someone has taken too much Ec-Naprosyn and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of an overdose may include severe stomach pain, extreme drowsiness, and seizures. It's crucial to get help right away in these situations. Remember not to share Ec-Naprosyn with others. Your doctor may want to conduct lab or medical tests while you are taking Ec-Naprosyn, such as checking your blood pressure, complete blood count, and liver/kidney function. Make sure to attend all your medical and lab appointments. It's important to consult your doctor for more details. If you have arthritis, making lifestyle changes like losing weight if needed and doing strengthening/conditioning exercises may help improve your flexibility and joint function. For specific instructions, consult your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. It is important to store Ec-Naprosyn at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed. When it is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.